services several years ago after working in psychiatric hospitals, working in prisons, working in detention centers. And I would talk to families and to clients, and they would say that at an early age or years ago that they noticed that they needed help or that they were having challenges and they really didn't know where to go. And by the time that I was interacting with them, it wasn't much that I can do because they were already in a center. So I wanted to start providing preventative services and coming out into the community and talking to people about what therapy is and what type of services that, other interventions that can be offered. So based on that, I started Fletcher PRevention services. And my goal was to educate the community on some of the services and other methods on how to prevent their, how to meet their needs pretty much. So one of the first things I started offering was individual therapy. And with that, I would provide services one-on-one in my office to all different ages. I started working with youth. From there, I started working with families, and then from there, I started working with community centers. I also offer group therapy, where I would work in schools and I might do a group on anger management, on social skills, just some of the needs that I identified with working with the community. Also from there, I started to grow to also offer consultation services. With talking to students and families, I might have identified some of the needs that might be effective for the whole entire school. So it might be something where we look at positive behavioral support and interventions that could be used for the whole entire school to prevent the need for individual therapy. From there, I created a website where I talked about my background, where I was from here in the city of Wilmington, what some of the needs are that I've identified from living in the city of Wilmington, and some of the experiences that I gained from working with prevention and behavioral health services and working in the prison systems. I wanted my program to be an all-inclusive program, so I started to partner with my family members. My sister, she's a chiropractor, so if I was meeting with someone and they were mentioning that they might have had some health concerns, and I might make referral to her agency, First Choice Chiropractic. I have another sister where she designed a music program. After having her music stolen, she started to work with individuals on how to patent their music and how to copyright their materials. So based on the needs of the individual that comes to me, I can refer them to different services. And I also want to connect individuals to Girl Track, which is a way to prevent more intensive medical services by being physically active and by getting out and exercising and encouraging sisters and females to be able to work together. But one of the things that I identified as one of my main needs with doing the work that I have is the business aspect of it. When it comes to the billing, working with insurance companies, being able to complete my books and being able to have that aspect of it. Because one of the things I wanted to do is that, what I noticed is that working with insurance companies, they will have a lot of parameters where I might have an individual that will come where they need more intensive services, and insurance companies might say, no, we're not going to pay for that. We definitely see that client might need that support, but we're not going to authorize it. So I wanted to be able to have an agency where I can say, okay, well, I will continue to see that client until it gets to a point where they can have that service authorized. So I wanted to be able to meet the needs of the clients and be able to be as supportive as possible. I believe that's all I have.
First question? Who has the first question?
Being downtown Market Street in the arts community, I see a great need for your service because you didn't mention art but art and music and everything else is kind of the core. We have so many problems, you'll hear in the news in Wilmington every day. So we have to start dialing and connecting. So I applaud you, and if I can help in any way. I see there's so many other, whatever you want to call it, fiefdoms of everybody trying to do something about it. We also got to unify so we can get everybody, if there is an art event going on or a music event going on somewhere, how do we get that message out so we get more of the problem youth or problem adults out to just get involved? Sometimes they just don't know about it.
And that's also a great way to connect to our youth as well, because a lot of them, they have goals and ambition in art and music, and being able to connect them to those resources is a good way to meet their needs.
And I think a lot of them don't even know the services are available. They're daunted by, like you said, the insurance world, they scare them off. That's the main objective.
Right.
Okay.
Is there, just an idea, is there any openings for you working within the various religious communities? They're in the business of helping people, for you to make more contacts, more clientele coming in?
I think that's a great idea. My father is a minister.
You understand?
Yes,
Okay.
and some organizations are open and then some are not.
So family is a big help to you in what you're doing?
Definitely.
People that need your services. I feel like people would probably need them and not realize it. Like I think you mentioned that, but
Yes. Well, I know currently a lot of my services come from the employee assistance programs. A lot of individuals that work, they have that as a component of their insurance. So right now, the way people are using them by getting a tap on their shoulder at work from their boss saying, I think you might need to talk to someone. So I agree with what you're saying, a way where it can be preventative, where it doesn't get to that point where you are referred by your boss, where a way where you can connect yourself. So another thing that I do is that sometimes the insurance companies will send me out to their health fairs, and I would talk to their members about the services that I provide and some of the reasons why it might be helpful for them to come.
Are you working at community centers? What is your targeting? Who are you targeting? You target customers? Is it work employees? I guess people that are working and are trying to get employees to come to you that have anger management issues, or is it the community in general, the young youth that you're trying to reach out to?
Well, I actually work with both. I work with employers and then also work with the youth as well. And with the youth, I go into the schools and I work there providing individual therapy in groups. And then for my agency on the outside, the employers usually send them to my office to provide that type of individual therapy.
Now, what is your training background? Are you like a therapist?
Yes, I'm a licensed clinical social worker.
Okay.
I have two questions for you. Are you profit or are you nonprofit?
Profit.
Have you ever considered a nonprofit?
Yes, I think that would be my next step.
I mean, if your father's a minister, he's probably familiar with establishing a nonprofit.
I don't think he's at that point right now.
Okay. The other question I had is, did you design your website or did you have somebody design it?
I created mine.
And you have control over it?
Yes.
Would you be open to ideas?
Yes. And I like your idea about putting my services first and then having a link where they can go connect to the other agencies. So
Right.
it just sees me and then I can connect you to
Right.
everything else.
The other thing, because you mentioned that, I don't know if you don't like doing the insurance aspect of it, or you're not good at it, or usually it's kind of both. Yeah. So, someone recommended this early on. He said, do an org chart. And I'm like, well, we're a 3-person company. Why would I do an org chart? This is like, first year in business. If you do an org chart, what I mean by that is everything that you possibly have to do, from marketing to sales to, patients to billing, all those different things, and then figure out who does that, right? So, well, I do it. What you'll find is you're doing a lot of stuff, and I think you need to ask yourself, okay, what don't I enjoy and what I'm not good at, do I outsource it, and how do I outsource it? Then it kind of just helps you identify, and then you look at it and you go, okay, well, I have 5 things I want to outsource, I can't do them all at the same time. Then you prioritize, we're going to get your biggest. So just an exercise that might be helpful.
Definitely.
How long you been in business?
I've been doing it since 2010.
maybe one suggestion I would have as far as for the homepage is maybe have like an event, even though you have an events, like maybe have like an events calendar on the page, so as soon as people visit the homepage, you can see at what events that you're going to be at, so whether it's community outreach or whether it's at a college, so maybe people can meet with you and discuss like some of the services they may need or inquire about the company.
That's a great idea. Thank you.
Time for one more question? Or a couple more questions, actually. Joan, appreciate it very much.